Chapter 1: Becoming a Caregiver. Our parents raised us. From the time we were born, they were there to fix problems, small and large, and supported us through every stage of our lives. And then comes a time when they need our help and support, and we become the caregivers. It seems like a daunting task, especially if we are also raising our own families at the same time. How do you become a caregiver for this stage of your parents' lives? This is new territory. Growing old is your future, not something you've done before. How do you navigate the complex world of elderly housing, financial, emotional, and medical needs? By learning from those that have already become caregivers, you will be better prepared to provide the best caregiving possible to your elderly parents. No warning. For some, becoming a caregiver starts without warning. The same parents who babysat for your child last weekend are now at the hospital, where your mother is crying in the waiting room and your father is having x-rays for a broken hip. Maybe your father calls to tell you that he's been diagnosed with cancer. Or your mother didn't answer the door when you came for a visit because she had a stroke and can't get out of her chair. Becoming a caregiver without warning is a huge shock. Your healthy and active parents can quickly go from being independent to needing care after a fall or a medical emergency or diagnosis. No one feels prepared for the sudden change, including your parents. Everyone's immediate concern is for the crisis at hand, but elderly people don't always recover from medical emergencies as easily as younger people do. The loss of mobility from a broken bone or serious illness can have devastating consequences for the elderly. Even a few days of bed rest starts to weaken muscles, lower blood volume, and damage bones. Prolonged bed rest creates a vicious cycle where damage from rest needed to recover makes a full recovery even more difficult. When a parent suddenly becomes ill, you do need to focus on their immediate needs. The first goal of the doctors is to repair or limit the damage caused by a sudden illness, but the next step will be recovery, and that's when being a caregiver really begins. Not every medical crisis will have a long recovery, but knowing that it could is the start of being a good caregiver. When my mother was first diagnosed with lung cancer and brain metastases, our lives sped into high gear. First, we learned about what options she had. Then I began the process of being her caregiver throughout her treatment. I wasn't thinking about the full scale of what that meant at first. It became a long road. When my father was diagnosed with bladder cancer 2 months later, it felt like I was on twin roller coasters. Their illnesses were similar, but also different enough to need 2 separate caregiving plans. Slow decline. Becoming a caregiver can also sneak up on you. You start to notice that your parents' home isn't as clean as it used to be, or that their refrigerator is a lot emptier. Maybe you've started to cut the lawn when you visit, because your father says he's too tired to do it. If you've noticed your parents are losing weight, and you have started bringing food when you visit, you have become a caregiver. It's often difficult to realize that your parents are slowly declining. They may refuse to discuss the changes you've noticed, or explain them away with half-truths, like saying they just finished the milk when they really haven't bought milk in 2 weeks. They might tell you they feel fine and don't need to take all their pills. We want to believe that our parents can take care of themselves, so our minds accept a new level of normal, and we tell ourselves they're just getting old.